We've got this notion among Republicans that they really want to move on this, but the same as before, right? They can't agree how to move. And now you have the president who's impatient and willing to entertain tax cuts first to move that ahead, which is, by the way, a recommendation a lot of people had prior to this whole battle over this. So let's go to Herald Group Vice President Sabrina Schaeffer and Dagen McDowell. Dagen, what do you think of that?
I think that the Republicans had 7 years to get this done, and that's where the impatience comes from the American people and the president himself.
So a split like this would only add time to it.
But why do you need to split it at this point? You've had time, you've had all of these years to work on a replacement. Again, these Republicans talk about we'll repeal and then worry about the replacement later, which is complete insanity. The only reason that they voted for repeal back, I think it was the last time in 2015, because they knew the president would veto it, and they didn't have to come up with a replacement. There's something working in this Senate bill.
And Collins was the only no vote on that at the time.
Right. Okay. There is something at work in this Senate bill that would reform a giant entitlement, and that is something that absolutely has to happen to avoid America going bankrupt, quite frankly. And if the Republicans can't step up and figure out a way to get this done, because this is some pretty easy stuff in terms of just slowing the growth of spending in Medicaid, then they're gutless and spineless, quite frankly.
And they're not long for their majority. You know, Sabrina, one of the things that has come up here is that even Republicans readily agree this isn't ideal, but most would say it is still better than what we've got. So we can go back to the American people and say, well, as horrendous as you think our program is, we're replacing something that's much worse. Will that really carry much weight?
Well, Neil, you know that my background is sort of political behavior and how do we sort of convince the public of some of these big changes. And something that keeps, I keep coming back to is this idea of loss aversion. People do not like to have things taken away from them, even if it was wildly unpopular to begin with. I think a better approach really would be to start replacing the bill and then repeal things that are bad. So
well, you'll have a lot of things taken away under that genre.
Well, let's start expanding some free market approaches to health care. Give people more ownership and control over those health care dollars.
But they're still getting something that they have taken away.
Well, ultimately, yes, but hopefully by that point, people will like something that they have, and I think that that could be a better approach.
There are elements that some Republican senators want in this bill to that point, say the health savings accounts, where you're really hamstrung about how you can spend the money in a health savings account. You have to have a high deductible plan. There are many senators who want you to be able to pay your premiums with that money. That is more ownership, and that would give people greater control over their own health insurance. That's one option.
But isn't it endemic in something in which you take away the requirement to purchase health insurance, that fewer people are going to purchase health insurance?
Yeah, duh, right?
So, why are we surprised that the numbers would dramatically change as a result?
Not necessarily. I mean, I think we do have to assume that people want to ultimately have health coverage, and so they're going to realize that if it's prohibitively expensive for them and it doesn't make financial sense, they're not going to.
I think it could be cheaper than anyone's business.
It absolutely could, just like TVs or anything else that we buy. It's a commodity.
But to your point, that's one of the reasons that the CBO numbers might be wildly off, because again, if you lose.
Is that what the delay is about, by the way? They keep bouncing this off, this provision, this, because I think it comes down to how many you're going to cover, how many will still be on the roll in 10 years.
Some of it's that, and you had the CBO came out with kind of more extensive numbers yesterday that Medicaid will get cut by 35% over a 20-year period. And just these headlines, again, these Republican senators have no gumption.
But how has it morphed into something worse, where now they're getting the blame for how bad Affordable Care Act is now, the one that they didn't vote for? They're getting the rap for that.
Well, I think
because they're in charge and they're not doing anything about it. And to that point, some of these insurers are saying, as they pull out of more states, as they pull out of more counties, they're saying, it is the fact that these policies were so expensive under Obamacare, but now we don't know what's going to be the replacement. So they are attributing, at least in part, that decision-making to the lack of action by the Republicans.
But Sabrina, here's where I get nervous, and no axe to grind here, but when I hear insurance companies are happy, like Anthem's happy with this initial effort, I'm not too happy. Because, we've all had run-ins with insurance companies, so it's not a good marketing tool for Republicans to use to say, hey, Anthem's delighted, you know.
Right, and I think the marketing and the messaging piece is a huge part of this, that for the last 6-7 years, Republicans have been investigating how can you message against Obamacare, and there has been, and I'm part of that conservative movement, but there has been, and I can say this, there's been almost no testing of how do we talk to people about what a free market system really looks like, because now what we're seeing is that
have we ever reversed a big government entitlement program?
No, that's,
I mean,
we call that path dependency.
Ronald Reagan did tweak Social Security around the edges,
right.
but in terms of
we didn't pull it back.
But
yeah,
Medicaid
right,
has grown so far beyond under Obamacare what it was intended to do, and that was cover the disabled and the very poor and poor women in particular. Now it has grown, the enrollment of Medicaid has grown by almost 30% under Obamacare. At 75 million people, it is the largest single insurer in the world. It's bigger than the National Health Service in Britain, and it's even bigger than Medicare.
And that's the ultimate problem.
And as it's blowing up in our face, 65% of annual spending is mandatory on Social Security, Medicaid, and Medicare. We can't afford this, and if we can't fix it now, this nation will go broke.